The Philippine Charity Sweepstakes Office, or PCSO, is a sanctuary of help, healing, and hope. A threshold that offers a hand to hold in order to cross over from an illness or injury towards healing and wellness, from the distress of deprivation towards some measure of assistance for medicines and hospital treatment. The PCSO is the face of care and the heart of compassion. It is your lottery ticket to charity. And tonight on NewsLife, we are joined by the Vice Chairman and General Manager of the PCSO, Attorney Ferdinand Rojas. Good evening, sir, and welcome to NewsLife.
Good evening, Robert, and good evening to all the viewers of NewsLife.
Now, sir, for the past 5 years of your watch, the PCSO has been committed to caring for people. Now, what other things are being done by the PCSO in terms of caring for the general public?
Well, basically, under our charter, for every 1 peso that goes into PCSO, automatically 30% goes to our charity fund. And the charity fund is what comprises all the charity activities of PCSO under the mandate.
Now, 30% comprise of how much, and how many people usually get to use this assistance in a year?
Approximately 8 to 9 billion a year. And for 2014, we spent 5.1 billion in direct medical assistance. This is our flagship program, the IMAP, or the Individual Medical Assistance Program.
Now, is this assistance open to all, or is there a criteria in terms of providing assistance to our people, those in poverty-stricken areas or those who have actually... Are there actually any restrictions on who can avail of assistance from the PCSO?
Anybody can avail. In fact, from the poorest all the way up to those who had money before, but maybe because of a disease or sickness which is continuous or lifelong, analysis, or those that needs continuous medication, their resources will be minimized, or it will really be stricken down. So this is where PCSO comes in. We are here to help augment the medical burdens of an individual. Of course, for the indigents, we give 100%, especially those the poorest of the poor.
Now, sir, for those who are not yet aware yet, where is the center of the PCSO's medical assistance, and do you actually have offices around the country for them to actually go and ask for assistance?
Our charity office, the clinic, is in Quezon City, is in the radiotherapy building at the Lung Center of the Philippines. But our 48 branches nationwide serves as a mini PCSO, and these are located in the major provinces. And the people in these provinces can just go there and seek medical assistance. When we first came in 2010, we only had like 25 branches. Here we'll be having 50. So our kababayans now doesn't have to go to the nearby province or take a ferry or take a boat to the nearby or next door province, but in their own very province itself, they can seek medical assistance.
Now, in terms of processing time, and what do those who need assistance need to bring to your offices for them to actually get the assistance from PCSO?
Well, the important thing is that all documents must be original, especially the medical abstract, the treatment protocol, or the hospital bill. Oftentimes, the mistake of our kababayans that they bring Xerox copies. But what we need are the originals. But once the documents are complete, especially if the patient is for discharge, they can get the guarantee letter even on the very same day.
Is there a cap or a limit in terms of how much assistance PCSO will provide? For instance, if it's a major surgery like kidney or heart transplant, etc., is there a limit to how much PCSO will provide?
There's actually no limit, in the sense that there's a formula after evaluation by our social workers as to how much can be given to an individual. Of course, if the individual is indigent, they enter the charity ward, everything is given to them. Because in the charity ward, there's no professional fee. They don't ask for room charges. But for individuals that would enter into private hospitals and would have private rooms, that's excluded.
Now, so what is the capability enhancement assistance of the PCSO Primary Health Care Capability Building Project?
These are the things that we give to the RHUs. We basically equip the RHUs with the basic equipments, and we have done this in a lot of the different barangays nationwide.
Now, you mentioned a while ago, before the interview, that you also provide ambulances for local government units, because as we know, if somebody calls for an ambulance, it's very expensive. Now, this kind of assistance, how much assistance is being given by the PCSO in terms of providing ambulances to these areas that actually need them?
Well, when we entered in 2010, we had a program wherein by the end of 2016, we would have given each municipality an ambulance, whether it's the municipality itself or if it's the local hospital in that area or region. So this year, we are distributing around 700 ambulances, aside from the 300 ambulances we have distributed 2 years ago. And by the end of 2016, we should have covered the whole of the Philippines.
Now, when you provide these ambulances to these local government units, these health centers, monitoring does the PCSO provide in terms of making sure that these ambulances are being used properly?
Well, number one, we have our branches that would take care of monitoring the movements of these ambulances. Secondly, in our deed of donation, we strictly prohibit the posting of names or the faces of local officials, because these ambulances are given by PCSO, and even the president himself does not want his picture or his face to be in the ambulance. So strictly, it's a PCSO ambulance with just the name of the municipality or the hospital and with the logo of our different products.
Now, I can just imagine how many of our people actually go to the PCSO and ask for assistance. Now, what is the process like? How do we ensure that those who actually ask for assistance really need it and they actually provide the right kind of...
Well, basically, you have the hospital bill if it's hospitalization. We double-check that with the hospital, and it must be clearly signed by the cashier or the collection officer. It's a final billing with all the other deductibles deducted already. When it comes to protocol treatments like chemotherapy or chemo drugs, these protocol treatments are signed by the doctor with the PTR number, and these are original documents. So, and these are also verified by our staff and doctors in our charity office.
And so finally, what other campaigns are being done by the PCSO in terms of creating more awareness to our people that there is an assistance like this that they can actually run to in times of dire need in their health? And also, what other projects are being done by the PCSO in terms of more, let's say, medical assistance outside for those who really need it?
Well, for the year 2015, we have this project called PCSO ASAP, or at source ang processing, meaning we have put up PCSO desks in 2 private hospitals, and there will be more private hospitals that will be joining us. And by next month, we are launching with 13 government hospitals in Metro Manila the PCSO ASAP, meaning the PCSO desk will be there right in the hospital itself. Evaluation will be done there, and right then and there, the patient or the family would know how much exactly would be the amount that PCSO can give to them. So that means they don't have to go anymore to our office in Quezon City to line up and to process their request for medical assistance. But right then and there in the hospital, they would get the amount deducted from their medical expenses.
And final words, sir, assurance to our people that PCSO is there to actually help in terms of health and medical needs to those who actually need it.
Well, I only say these things to our kababayans, no, na the PCSO does not really get any money from the national government. We are a revenue generating agency. As such, we can only give what we earn. So, pinakikiusapan ko ang ating mga kababayan na tangkilikin po ninyo ang produkto ng PCSO tulad ho ng Lotto, Lotto Express, ang aming sweepstakes, scratch cards, small town lottery at iba pa hong pangapalaro. Sa bawat piso ho na tangkilik ninyo sa aming produkto, automatic ho 30% ho niyan ay napupunta sa aming charity fund. At pag kayo naman ho ang nangailangan, sa susunod, sigurado naman ho na nandyan ho kami para tumulong sa inyong And if you can give me just a few seconds, sa Friday, ang aming Ultra 658, aabutin po kami ng 225 million. Kaya pumila na po kayo ng maaga sa inyong mga suking lotto outlets.
Okay, on that note, thank you very much for joining us here tonight at NewsLife. That was Attorney Ferdinand Rojas, the Vice Chairman and General Manager of PCSO. PCSO, a truly healing life institution. Thank you so much.
Thank you very much, Robert.